Poso maoni wiak, waiwanan kitanan imua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman and e hisikimaka e yoso Menominee kihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Wapoose. On this episode, I am joined by guest Vaughn Bowles. He is the Public Information Officer for the Incident Command Center for the Menominee Indian Tribe of Wisconsin, and he is once again here to speak about the COVID-19 pandemic. So Vaughn, what are some of the updates that we can share with the community regarding the COVID-19 pandemic?
So one of the things that we really need to understand is that COVID-19 is basically everywhere right now. We now have a positive confirmed case on the reservation that is a tribal member, and people should be aware of that. Given that fact, they should also understand that, there are different levels of contact and different levels of risk associated with COVID-19. One of those is that there's direct contact with a positive patient, and there's also indirect contact. A person that has direct contact is exactly what it sounds like. It's person to person usually. An infected person could touch or exchange bodily fluids with someone that isn't infected. I know it doesn't sound appetizing at all because it's not if you think about it. And it's usually, in the case of respiratory illnesses like COVID-19, it's in the form of what are called respiratory droplets. These could be phlegm, mucus, that are sneezed out, coughed out, float into the atmosphere when someone's laughing or talking, and they're very, very common. Usually they don't travel too far unless, someone's coughing or sneezing. That's why we recommend social distancing. When you're talking about something like indirect contact, though, indirect is when a mechanism or a virus is airborne. Particles just stay suspended in the air for a while. With COVID-19's case, they've found that it can remain in the air for about 3 hours at a time. However, if you're in a wide space or outside, the amount of particulates are usually very minimal. It means you're at fairly low risk. You could also be exposed to indirect contact due to a contaminated surface. This is when the respiratory droplets land on something. These could be, any common item, doorknobs, keyboards, phones, screens, whatever, common items. And so that's why we recommend you regularly clean these types of surfaces with some of the EPA approved cleaning products. Transmission really occurs when you touch these contaminated surfaces and then you put them in your eyes, your nose, your mouth, and other means of transmissions like that. You can also get indirect contact if you're sharing food and drink with people, so please don't do that right now, even though you love your kids. Don't eat their leftovers. I know it's tempting. You can also have person-to-animal contact. That's initially what COVID-19 was. They call these zoonotic viruses, and they've found that pets like cats and dogs have been able to contract COVID-19. Not very common, but it's still a possibility. You can also contract from wild animals. Also pretty uncommon, but it is a possibility. So that's why we encourage the social distancing, again, with people that you live with, people you may come into contact with. We really want you to stay safe and stay healthy.
So you mentioned some approved cleaners. What can you list what some of those are?
There actually is a huge list on the CDC and the EPA's websites. There are more than 400 cleaners. They're basically most of your approved cleaning products out there, things like Clorox and Lysol and stuff like that. So it's nothing crazy that you need to go hunting down.
Okay, so this weekend is Mother's Day. What is some advice you can give for people regarding the holiday?
Call your mom and tell her you love her. As much as we, would love to be with our family members, we really encourage people to maintain social distancing and not get together in large groups, even during Mother's Day this year. So that's why we say call, Sharing is not caring when it comes to viruses. So, stay safe, stay healthy. Let your loved ones know that you do love them and care about them, but please do so at a safe distance and in a safe manner.
We asked for some questions from community members, and there were some submitted. So here are the questions that we received. Are you testing employees, and if not, why not?
So the answer is yes, we are currently testing employees. Due to the amount of test materials we have right now, we're only testing our symptomatic employees. And these are people that may have things like fevers, coughs, shortness of breath. The regular symptoms of COVID-19 are the ones that are associated with COVID-19. We've tested 10 of our employees so far. These have all mainly been in healthcare fields, the clinic and whatnot. All of them have tested negative, though.
The second question was, have you thought about using the telephone system for automatic updates for people with no internet access?
Yes, we have. We should be sending out a new message on the tribe's information line. It's 715-799, then it's 7,000. We should be updating that message this afternoon.
And is there anything set up for people who want to make donations?
Yes, and it really depends on the type of donation you have or want to contribute. If it's a monetary donation, checks can be made out to the Menominee Indian tribe, and then you can designate what you want the donation to go to, whether it's COVID-19 related or if it's for something else like food or whatever. Just specify that on the check. If it's supplies like canned goods, those can go to Mia Hess and her team there at the Public Safety Building in Middle Village. Those can be dropped off there. If it's other materials like face masks, the homemade cloth face masks, those can be dropped off at the Tribal Administration Building.
Okay, great. Was there anything else you wanted to add?
Just stay safe, stay healthy. I know sitting at home can be a drag, but at the moment it's really something that will help flatten the infection curve and can keep all of us a little healthier long term. And so we'd really encourage that at this time.
Great. Thanks for coming on again, Vaughn. Your information is always really helpful.
You bet. Thanks for having me, Sheena.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcasts. We are aiming to do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19. Please send them in to us via email at podcast@mitw.org.